Atrial fibrillation is the most common arrhythmia. And arrhythmia just means funny heart rhythm. It is the top two chambers of your heart. Normally, in a normally beating heart, the top two chambers contract and then the bottom two chambers contract. With atrial fibrillation, the top chambers no longer contract. They just kind of quiver. They quiver like this. We call that atrial fibrillation. So what's happening is they're just quivering, and blood can pool in those little crevices. The heart is not just like a big, shiny surface. There's like little crevices. There's, trabeculations in there. There's holes. Blood can pool in those little areas and form clots, and then those clots can break off and go to your head and give you a stroke. That is devastating. So atrial fibrillation is one of these things that we treat as physicians, where we try to get you back into rhythm as much as possible. There's medications. There's medication ways to do this. There's things called ablations. There's something called a Watchman device or a Watchman procedure that we do. There's all kinds of things we can do to help you eliminate atrial fibrillation and reduce your chance of stroke. Now, sometimes this will mean that you need to be on stronger blood thinners to try and reduce your chance of stroke. But a lot of times that, combined with the correct medications, maybe an ablation, and various other things, we could probably reduce your risk of stroke back down to what it was normally, is as if you didn't even have the Afib. So ask one of your Toledo cardiology providers, whether it's one of our cardiologists or one of our nurse practitioners, and we will get you on the right track to treating your atrial fibrillation in any way that is required. We have the capabilities at our staff and our office to treating medically for atrial fibrillation, as well as mechanically and ablations and electrically if needed, as well as the Watchman procedure.